Building a strong immune system. There's never been another time like 2020 and beyond to build a strong immune system, and you know all the reasons why. Now, this is something we've been talking about for quite some time because I have a trademark or an acronym called HIDDEN, which stands for Hormonal Balance, Immune Strength, Detoxification Efficiency, and Neurological Connection. So you know we've been talking about it for a while because you don't get trademarks overnight. So I've been in practice 37 years. I have patients traveling from 21 different states to our office, mostly for autoimmune type of care. So this is something we're quite familiar with. So let's dig in and show you how you can have a strong immune system and how it's mostly up to you. So 2020 has been quite a challenge for everybody, but what seems to us as a bitter trial can often be a blessing in disguise. And if we develop a stronger immune system, it will be a blessing in disguise for us all, in that we'll have better resistance to other bacteria and viruses, and we'll have better cancer resistance and much, much more. So I'm so excited to share this information with you. Now, straight from my immunology textbook, it says nutrition, age, stress, and genetic factors frame the predisposing features of host resistance. Host resistance is how strong we are, and it's such a powerful concept. When we nourish that which is within us, we become stronger to that which is from the outside. And let's face it, the truth is medicine has no ability to make your immune system stronger. Therefore, it only seeks to manipulate your immune system with vaccines and much more, and manipulate its exposures with masks and social distancing and things like that. So this webinar isn't to debate any of that. This webinar is to show you how to have a strong immune system. So we'll cover all the things you can do to have a strong immune system, how to test your immune system, and ways we could help you additionally if needed. 90% of this is in your hands. So let's get started here, and we're going to talk about the 3 S's: stress, sugar, and sleep. So stress is an interesting thing. Acute stress upregulates the immune system. Like when we go for an exercise, that's acute stress, and it upregulates the innate or natural part of our immune system. But ongoing stress hammers our immune system. It leads to chronic downregulation of the immune system. So stress affects our immune system defenses. It keeps us in fight or flight and weakens our immune system. It leads to more infections. It negatively changes our entire immune system. It gives us more illness risk and more recovery time. And this is a study I use a lot in my other talks called Cumulative Childhood Stress and Autoimmune Disease in Adults. And we see there that persons with autoimmune disease have a significantly greater risk of hospitalization with autoimmune diseases if they've had ACEs. That's adverse childhood events. Those are things like your parents divorcing, a parent going to jail, a parent being an alcoholic, and many, many more childhood traumatic events. If we have those, we're much more likely to have autoimmune disease as an adult, and that's basically an imbalanced immune system that causes the immune system to attack your body's own tissues. So that's some of the research on that. And then QNRT, quantum neural reset, is a proprietary technique that we use to create a quantum shift in the nervous system and reset the response to emotional triggers, both past and present emotional trauma. And when these triggers are reset, then cortisol changes and immune system messengers called cytokines change, and a major disruptor of the immune system is eliminated. And I will soon be the only 5th master practitioner ever in this technique. So we can identify our triggers, we can manage our time better, we can have some me time, we can learn to say no, we can practice deep breathing, we can exercise regularly, and we can get more sleep. Those are things that we can do on our own. Now we want to look at our diet because there are foods that cause inflammation and there are foods that fight inflammation. Refined sugars cause inflammation. The next slide will show us more. Refined grains break down into sugars quickly, and trans fats are horrible for our immune system and for our inflammatory pain systems. Foods that fight inflammation are grass-fed meats, wild-caught fish, chicken, omega-3 eggs, vegetables, and leafy greens. So one of the problems with sugar is it decreases the production of antibiotics. That's in the lab. When they're making antibiotics, they can't even make them in the presence of sugar. Sugar interferes in the transport of vitamin C into the cell. It causes mineral imbalances that weaken the immune system and mess up our ability to get a good fever that fights infection. And sugar feeds the unhealthy bacteria and funguses in our gut, and it destroys the germ-killing ability of the white blood cells for up to 5 hours after we ingest sugar. So sugar competes for vitamin C entering in the cell, and high sugar in the blood is a huge disadvantage for viruses and a huge factor in the COVID-19 virus. Many people that don't do well with it have blood sugar handling issues. But our immune systems need sugar. They just need healthy sugars. They need the kind of sugars that are in real foods and not the kind of sugars that are in processed foods. Sleep is such an important factor also. Sleep deprivation increases the risk of viral and other infections. Animals deprived of sleep eventually die, and systemic infection is the cause. Sleep deprivation impairs immune functions, especially natural killer cells and many other things. Sleep deprivation cancels out some of the protective effects of vaccinations, and sleep deprivation raises the risk of pneumonia or the common cold 3 to 4-fold in many people. So sleep is a big, big deal. So our circadian rhythm is our body's internal clock, and it affects not only our sleep, but our immune system. You can see here that the immune system also displays a circadian rhythm or oscillation. And so what they find out is certain immune cells are more active at different times of the day. Once our circadian rhythm gets off, our immune system is severely off. And this crosstalk between the circadian rhythm and the immune system is disrupted. So we can't have healthy immune function without healthy sleep and without healthy circadian rhythms. So we want to do things like control the amount of blue light in our eyes in the evening. We want to get to bed at a regular time. We want to get up in a regular time. We want to get some outside light in our eyes at a regular time. All those kinds of things to keep our circadian rhythms healthy. And that's something that we specifically help people with, resetting their circadian rhythms. In fact, we've had to do that hundreds of times during COVID-19 for our patients because stress also causes the circadian rhythm to get imbalanced. Now, let's look at some of the nutritional factors affecting our immune system. And we'll go from A to Z. So vitamin A supports the lungs and mucous membranes, and we get that in foods like peppers and sweet potatoes and carrots and things like that. B vitamins are involved at the DNA level of making new immune cells. And vitamin C, as we mentioned, is so important. When we have a high sugar intake, it competes for C into the immune cells. So we're not going to go into the details of all this, but you can see virtually every type of immune cell, neutrophils and macrophages and natural killer cells that we'll talk about testing later, B lymphocytes, T lymphocytes, they all are affected by not enough vitamin C. So we can get vitamin C in our diet from lemon, from rose hips, from chili peppers, from wild strawberries, from spinach, from broccoli, cayenne pepper, cranberry, and foods like camu. And so when we don't have enough of these foods, we're going to have trouble. And we often use a whole food concentrate of vitamin C with patients, not vitamin C that's made in a lab. Most of that is made in chemical labs, and it's made in China. That's ascorbic acid. That's just the shell of the vitamin C complex. So we are talking about the whole food complex here. Very important differentiation. Now, vitamin D can modulate the innate and adaptive immune responses. Its deficiency is associated with increased autoimmunity as well as increased susceptibility to infections. And low vitamin D has been linked to increased COVID-19 risk. Everybody right now ought to have their vitamin D at a level of 50 or more, and that's something we test along with our immune panel. Now, moving on to vitamin E, it's a fat-soluble nutrient in many foods. It helps boost the body's immune system to fight against bacteria and viruses. We can get it in many healthy foods like avocados and green leafy vegetables, apricots, and more. So vitamin E is very important as well. And then another E is exercise. And exercise is very helpful if we don't overtrain. So moderate intensity exercise improves immune function. Immune function is greater in elderly that are conditioned to exercise. It reduces the risk of and severity of respiratory and viral infections. And natural killer cells are boosted temporarily when we exercise. So exercise is a big deal. If we over-exercise, though, we can deplete our system and deplete our immune system. So just listening to our body on the right amount of exercise is very important. Now, F, we think of fermented foods. Fermented foods have lots and lots of healthy bacteria. Sauerkraut would be one big example. And other foods that are fermented, kombucha and things like that, although they have lots of sugars, can be very helpful. So there's lots of fermented foods that can strengthen our natural masks, our natural barriers. Healthy fats can do the same. Avocados are super healthy for us and contain lots of these healthy vitamins. And fish oils are very important to modify the immune response as well. So healthy fats. And then G for garlic. Garlic increases natural killer cell activity. It's a very natural food. The selenium in there also helps natural killer cell activity. As we mentioned, natural killer cells are increased from exercise and are increased in natural environments. They did a study of nurses and they found out that when they tested the nurses' natural killer cells in the hospital environments or when they were living in the city, their natural killer cells were lower than when they had been in nature for a few days. So nature helps increase our natural killer cells. And G, we additionally think about God, because I want to show you in this presentation that a healthy immune system isn't all about nutrition. It isn't all about exercise. It's about the whole picture. And so there was a study a few years ago on HIV positive patients, and those who viewed God as benevolent and forgiving were able to maintain low viral loads and better CD4 cells. We'll show you those later. Those are cells that help organize our immune response. They had better CD4 cells over a 4-year period than those who viewed God as harsh, judgmental, and punishing. And there have even been studies where those who went to church regularly had stronger immune systems. And this is unthinkable in the time of COVID, but prior to COVID, we studied things like this, and hugs may protect against illness. So they studied 400 adults, and they found that hugging might be able to reduce the chances of a person getting sick in the first place. And it found that those who had greater support system, which included physical touch, were less likely to get sick. And even if they did get sick, the symptoms would be less severe than those with little or no support system. So a lot of things have changed in what's given to us during this time of COVID, but actually hugs can be very beneficial to our immune system. So a new study analyzes how falling in love influences the immune system. So love even has a powerful effect on the immune system. So we want to be in a state where we're loving and where we're giving, because we'll have a much stronger immune system than when we're in a state of fear. And the last nutrient is zinc. Zinc is a gatekeeper of immune functions. Zinc deficiency atrophies the thymus gland where T cells mature. It leads to unbalanced numbers in our T and B cell function and can create lots of problems. And we get zinc in so many natural foods, again in nuts and avocados and many other whole foods can give us zinc. And we can do a taste test. If you're a practice member in our office, we do a zinc taste test. We give you a solution of zinc. If you're zinc sufficient, you'll have a yuck taste right away. If you're zinc deficient, you won't taste anything. And if you're a moderate deficiency, you'll have a delayed sensation of the taste. But zinc is hugely important as well for our immune system. Now let's talk about testing our immune system, because right now people aren't having their immune systems tested. They've never had their immune systems tested other than the complete blood count, which is like a 30,000 foot view. So we'd like to do a T and B cell lymphocyte natural killer cell. So our lymphocytes are the specific combat cells in our immune system, and we want to see how healthy they are. By finding out how healthy they are, we can create a specific immune program for you. And here we're looking at natural killer cells. In this person, there are only 72. Those are low. They're your first line of defense against viruses, and they provide tumor surveillance. So they help kill cancer cells, and we want to get this person's natural killer cells up closer to 150. So we're going to use things like garlic. We're going to use adrenal adaptogens and many other techniques and to help them get their natural killer cells up. That will not only make them stronger against viruses, but it will help with tumor suppression and decrease their risk of cancer in the future. So this is again a T and B lymphocyte natural killer cell profile. It's not a test you're going to get in the medical model. You're not going to get the test because they only use it for HIV positive patients and patients with blood cancers. So essentially your immune system has to fall apart. Your immune system has to fall apart before you can get tested very specifically on your immune system in the current medical model. Now, let's look at a next test. This is a test where the CD4CD8 ratio was altered. Our CD3 cells here are immune cells that are like stem cells for our T cells. And T cells fight infections inside the cell. The CD4 cells help organize. So you can see they're called helper cells. And the CD8 cells help fight or kill the infection and suppress the infection, and they're called suppressor cells. So a low ratio equals immune weakness. This test is in a 22-year-old person. A weak immune system in a 22-year-old person. So age, while it does make a difference, it doesn't make that much difference because we've tested 85-year-olds that had stronger immune systems than several of the 20-year-olds that we've tested. If a person has a high ratio of the CD4-CD8 ratio, they can't shut off they can't finish the job with infections. And so they're like a real estate agent that can get lots of houses listed and can show lots of houses, but they can't close the deal. They can't close the deal, they can't make the sale, and they can't get a for sale sign stuck in the yard. So with this person having a low CD4-CD8 ratio, we're going to use zinc thymus extracts. We're going to use quantum neural reset therapy that we talked about to release stress. And we're going to use immune adaptogenic herbs to help the immune system adapt better. Now this person is in the medical field. They have a low lymphocyte count. CD19 cells are B lymphocytes. That's part of the adaptive immunity. They fight infections outside the cells. Remember, T cells fought infections inside the cells. These fight infections outside the cells, such as bacteria and the extracellular phase of viruses and some funguses. They're in the lower 20% of the range, probably the lower 15% of the range. So we wanted to get those up. This person also has a neurological condition, and as I mentioned, they're in the medical field, but they're coming to me because natural support is what they know they need because they haven't got help in the medical field. So with this person, we're going to use high DHA fish oil because that's been shown in the literature to support B cells, and it also helps with inflammation with neurological conditions. So that's going to be the way that we're going to address this person. So you can see we address people very, very specifically based on their labs. And if you don't have a lab, we're not going to be able to address your situation at the level of specificity that we can if you have this immune panel lab. So this is a person who, or this slide's about a person who never had a normal white blood cell count in their entire adult life, never in their adult life. And in November, their white cell count was 3.1, which is lab low. We started working with them on January 13th of this year. They started QNRT to release emotional trauma. And then they started Imiplex for nutritional support. And on 2/20, we had their white blood cells tested again, or their physician did for another reason, and they were at 4.05, the first normal white blood cell count ever in their entire life, again, from releasing severe emotional trauma and from building the immune system with a very specific supplement. Now, this young lady had severe autoimmune disease. First, she had Hashimoto's, which is low thyroid function, and had to be on thyroid medication for that. Then she switched to Graves' disease, which is hyperthyroid function. She had a thyroid storm. She had to be carried into the hospital and be hospitalized for a week with a heart rate of like 180 beats per minute or more. Total weakness, etc. But when we worked with her, finding the specific infection that she had and then releasing trauma from the brain using QNRT, she totally recovered. She's now not on any thyroid medication for the last 2 years. And now we did an immune panel on her, and she has a perfectly normal immune system. You see, our immune system has the ability to heal and be normal if we deal with those modifiable stresses that we talked about in the beginning. We take away stress, and with QNRT quantum neural reset therapy, we're taking away specific stresses in the brain that are driving the immune system off. And then we're feeding the immune system with specific nutrition. It makes all the difference in the world. So you can create a stronger immune system. It's mostly up to you. If you do need or want additional testing and specific natural recommendations, then contact our office at 270-554-2141. Email us at info@winterswellness.com. Seek us out on winterswellness.com and find Winters Wellness Center on Facebook and YouTube. I look forward to hearing about your successes with a stronger immune system.